So this next mini lecture is going to examine a special topic in pharmacology called the therapeutic index. All right, and so the therapeutic index, also known as the therapeutic window, is a mathematical ratio between the TD50 and the ED50, which is shown here. So the ED50 is the median effective dose, or the dose at which 50% of an effect is reached. And so that effect is arbitrary. It could be a 20 millimeter mercury reduction in blood pressure. It could be a 50% reduction in LDL. It depends on the drug. The toxic dose, TD, is the dose in which 50% of the population in a test group experience some toxicity. So, you know, for a beta blocker, it could be bradycardia, below 40 beats per minute. For the statins, it could be the incidence of rhabdomyolysis. So it depends on the patient. So these criteria are predetermined before the study occurs. And what this relates to is how safe the drug is. Okay. And so the following drugs, warfarin, phenytoin, I know we haven't covered all these, valproic acid, carbamazepine, theophylline, which we just talked about, cyclosporine, and digoxin, which we've already talked about, all have a narrow therapeutic index. Okay, and so this is a really nice visual of what we're trying to describe here. All right, so here's the dose. Okay, and the ED is, say, 1.5 or 2 milligrams, and the TD, or the toxic dose, is, say, 7 or 8 milligrams. Okay, so this is your therapeutic window right here. All of your patients have to be in this yellow region. Okay, if they're in this green region, it's subtherapeutic, and there's very little clinical benefit to this drug because it's essentially not working. It's not enough drug. All right. If they're in this green portion, they're experiencing toxicity and they're getting too much drug. All right. And so in order for this drug to essentially work and have optimal clinical outcomes, you have to be within this yellow region. Okay. So this is your therapeutic window. So this window is quite small, right? I mean, you're only looking at between 2 and maybe 7 milligrams. Okay, and so if you take too little, you're not going to receive enough therapy. If you take too much, you're going to experience toxicity. Okay, so these drugs that are listed here, okay, all have a narrow therapeutic window. This is in contrast to this drug, which has a really wide therapeutic window. Okay, so drug X has a wide therapeutic window, or therapeutic dose. Which of the following can be inferred about its clinical use? It's not safe, and it must be administered by an experienced physician. It's very safe and can be seen commonly over the counter, and it has a great safety profile and even can be administered by a first-year resident on the first day. All right, and so the correct answer here is actually B, but also C. And this is what the therapeutic index looks like for something over the counter, say ibuprofen, Tylenol, over the counter cough syrup. Okay, and so basically you can give as little as 5 milligrams or as much as 40 or 45 milligrams and still experience therapy and not experience toxicity. Okay. And so these drugs have a wide therapeutic window, and they're quite safe. So to kind of compare, this is what the mathematical representation looks like. Drugs that have a low or a narrow therapeutic index tend to be not safe. Okay, and these drugs need meticulous monitoring. So what does that mean? You physically have to draw the patient's blood every so often to be sure that they're in this relatively tightly controlled range. Okay, so if the TD is 8 and the ED is 5, the therapeutic index is 1.6. That doesn't give you much room for dosing adjustments. And as this points out, there's a very fine line between too much drug and not enough drug. Okay, you only have 3 milligrams to play with. In contrast, drugs that have a high or a wide therapeutic index tend to be much safer. It doesn't mean they don't have side effects or toxicity, but they tend to be much safer. And they tend to offer a greater amount of dose adjustment over time. So this drug is relatively safe. Okay, so that means that patients can take as little as 5 or as much as 40 milligrams and not really experience much toxicity. They may experience some side effects, but that's not how it's defined. Okay, and so really this kind of relates to how safe is the drug. And so in terms of patient monitoring, patient management, drugs that have a narrow therapeutic index, these patients have to be monitored much more closely compared to these patients that have a wide therapeutic index. And just by definition, almost all of your over-the-counter drugs and drugs that are used for children typically have a wider therapeutic index. And then those drugs that are used in children that are not safe, that need meticulous monitoring, are best administered in the hospital, okay, and require meticulous monitoring and dose adjustments. Okay, so this is kind of a brief summary of therapeutic index. We'll talk about this throughout the curriculum, and even when you look into clinical references for specific drugs, it'll say drug X has a wide therapeutic index. You know that by definition it's relatively safe. In contrast, drug Y may have a narrow or a small therapeutic index, and then by definition you know that you're going to need to monitor this patient quite closely, and you may want to double check the dosing calculation that you've done to make sure that they're not experiencing any types of toxicities. So that's the end of this therapeutic index mini session. We'll continue now through asthma.